All right, so this is Don. Don has a cherry eye. Medical term for that is a prolapsed gland of the third eyelid or the nictitating membrane. So this spot right here is normal. That's the third eyelid. And then this swollen spot right here, this is the gland. And the gland should sit down underneath here. You can see on his other eye, there's his third eyelid, the pink part here, and you can't see the gland at all because it's in normal position. But over here, it has swollen and then kind of popped itself out. And that's a genetic predisposition. There's lots of breeds that are prone to it. Pretty much any breed that has a smushed face or brachycephalic dog, these dogs are prone to it. So what we're going to do is that we are actually going to create a pocket to stick this thing back in. So it's called the Morgan pocket technique, invented by Dr. Rhea Morgan. And the reason why you want to replace it versus just cutting it out is that this gland can produce up to 70% of the tears in the eye. And so if we just remove it, we're at a high risk for dry eye. So we're going to put it back into place. It's still going to be swollen once we put it back into place, but once it's back in place over the next couple weeks, the swelling will go down and then it will function normally. Now that the eye is prepped, I'm placing some stay sutures in the corners of the third eyelid to hold everything in place for surgery. And once the stay sutures are in place, I'm taking a very small scalpel blade and making incisions on either side of the swollen gland. And after we've made those incisions, I'm going to take a suture and tie a knot on the front side of the third eyelid. And I'm going to pass that suture to the back side of it and use that suture to sew the edges of those two incisions together. And that'll push the gland down and hold it in place. And once the gland is back where it's supposed to be, then it won't be swollen anymore. And then I'm going to tie my knot on the front side of the gland. And that way we make sure that no sutures are actually rubbing on the eye. Now you can see the blue light and put some stain in the eye to make sure that we don't have any scratches after surgery. All right, so his gland is back in the normal position. The third eyelid is swollen. That's very normal after doing the surgery. You can see the whites of his eye appear as red and irritated, very normal after surgery. But about a week or two and it'll look totally normal, like we didn't do anything.